Moving on to the next part, we're going to be looking at your ability to kind of control, move, and stabilize your lower body relative to your upper body. So for one of the first tests for that one, again, is going to be getting into that golf kind of 5-iron setup posture. Arms across your chest, on your hands placed on your shoulders. And then from here, without letting your shoulders move, you're going to try to rotate and isolate movement at your pelvis. Again, the main focus is that your shoulders aren't moving with that movement. That's important because that's going to play a large role in terms of your ability, more so with the downswing, to help kind of control and disassociate so you can create as much power and speed in that club head with the golf swing. So for the next test in the lower body disassociation, we're going to do what's called the lower quarter rotation test. So for this one, we're looking for 60 degrees of rotation, and we're assessing it for both the movements for your backswing and your downswing. And we're really looking at the mobility and the hip. A little bit's coming from the knee, a little bit's coming from the ankle. So we'll set up some clubs that'll help give us that rough estimate of what 60 degrees should be. Facing one of those clubs, you're going to place all of your weight on one foot to slightly toe touch on the other side. Hands on your hips, and just trying to maintain your height. You're going to twist as far as you can towards the other club, and we're trying to see if you can get to or past, ideally, that other kind of line of the club there. And again, we're going to look at both sides for the backswing component, and then we'll also kind of face the other club, and we look at both sides for the downswing component. The last one for the lower body disassociation movements is just looking at a toe touch. So for this one, just like you might be imagining as a toe touch, we're just looking at your ability to hinge at your hips, keeping your knees straight, and trying to touch your toes and back up tall. If there's a limitation there, anything that we need to look at further, then we'll look at each side individually and see if we can kind of figure out which the culprit is in terms of what's making that difficult.